Good evening, everyone. Let me welcome all my viewers once again today on Heart Mitra. It's always a pleasure connecting with you for these live programs. And as you know, not only on a daily basis we post information related to good cardiac health for all of you, but also for you we invite leading cardiologists from across the country who can talk to you directly as a friend and answer the questions which you have in mind. I'm very happy today to welcome here Dr. Anup Mahajani from the city of Mumbai. So, welcome to the program.
Thank you very much.
We will use your expertise, sir, to ask some of the questions which our viewers want to know, and we will take up the discussion on. We see nowadays a lot of heart attacks are happening in the younger population. We see it on news and television that a lot of even young celebrities getting affected with that, and therefore it has got everyone's attention. So today we will seek your help to answer some of the questions related to it. However, before I start asking the questions to Dr. Dhanup, let me, for all of you, formally introduce him as well. He is one of the leading interventional cardiologists practicing at Navi Mumbai in Medicover Hospital. After doing his super specialization in the field of cardiology in 2019 from Apollo Hyderabad, for last 5 years he is serving his patients. And during his training and later on in the practice, he has done more than 1,000 coronary angioplasties till now, and also implanted permanent pacemakers to around 50 patients. He is also publishing papers and doing programs of education for his peer colleagues and for patients as well. So, welcome to the program, sir, and let me hand over straight away to you to set the context on this topic, that why this is important today. Discussion on this topic. How commonly you actually see younger patients coming to you with heart attack. So, over to you for your opening remarks.
Right. So, good evening, everyone. So we'll start with what do we mean by heart attack in young people? So previously, we all knew that heart attack is a disease of elderly or disease of those who are above the age of 50 or 60. But in our recent practice, we are seeing a lot of young individuals having heart attacks. So by definition, by book definition, heart attacks occurring less than 45 years of age are called as young heart attacks. So in medical language, it is called as young myocardial infarctions. Basically, 45, I would say, if you can give a percentage for every class. So suppose the first class is the young heart attacks, which is age below 45 years of age. So at least 10% of the population having heart attacks, 10% of heart attacks will be in this particular segment. And from 45 to 65, another 35 to 40% people of heart attack will be there, and above 65, another 35% will be there. But actually, when you see in a hospital experience, that what we see and what actually been published many years ago about this 10%, we are seeing almost 20 to 30% of the people having heart attacks are basically in the age group of less than 45 years. Why it is happening is basically lack of education about, or lack of awareness about, how to lead your lifestyle. And we all know that smoking, diabetes, hypertension, obesity are the leading causes of heart attack in young people. But there has been a lot of studies regarding stress and lack of sleep, which eventually leads to hypertension, diabetes. And also because of stress, many people tend to go for a smoke. Or you might have seen many people who are working in corporates, they take smoke breaks in between, and it increases number of cigarettes in a day and eventually leads to a heart attack. So basically, you can measure your diabetes, like you can measure your sugars, you can measure your blood pressure, you can measure the number of cigarettes you are smoking, but you will be never able to measure how much stress an individual is having. So that's the main problem here. And suppose if I say that I have this amount of stress, if Mr. Sanjeev have this amount of stress, but we don't know how much stress that individual is having in particular. And if you can read about many articles on stress, they say that having a stress, having an extreme amount of stress, is almost equal to smoking 20 cigarettes a day. So that kind of problem that is going to cause you on your heart. So that's the reason, because of tremendous stress in the workplace, or addictions, or sometimes people go for weekend parties and binge drinking, and lack of exercise is the main cause for heart attack in young. Another factor I want to emphasize is that those who have significant family history of heart disease. So when I say a significant family history, it doesn't mean diabetes and hypertension. It means that in a family, somebody had a sudden cardiac death at very early age, or somebody had a heart attack which required a bypass, or which required angioplasty, or somebody died because of it. It means a significant family history of a heart disease, and those people are very prone for heart attacks in the young age. So I have seen a few patients below age of 20 also having heart attack. I have done their angioplasties, and the main reason for that particular age group, most of the time, it is substance abuse, which has been very common nowadays in a particularly age group less than 25 years of age. And the commonest things are, cocaine is a big problem. Some, the kids get it easily here and there, and eventually they get they just abuse the drug, and that is one of the major causes for heart attack in the people or the youngsters who are below 20 years of age.
Okay. So I think what we understand from Dr. Anup is that it is having heart attacks in younger population is definitely a problem, and there are approximately 20 to 25% of total heart attacks which may be happening in the age group of less than 40, and therefore this needs attention. He has also helped us understand that which are the people who are at higher risk of getting this problem, like if you have a family history, or some of the habits he talked about, like smoking, alcohol, stress, and this may lead to someone getting heart attacks at a younger age group. So thank you for highlighting all those things. Now, whatever things you have mentioned, I think except for family history or maybe smoking, rest everything is common to, I think, the whole
Yeah.
population today, which we have, the young population. Then how can someone, he can or she can have some early signs, or early warning signals that that he or she would be at a higher risk, or maybe having some early signs of a cardiac problem, so that they can then take further action. So would you like to highlight some of those things?
Right. So the first we'll talk about those who are having a significant family history of heart disease, like a coronary artery disease required bypass or a angioplasty for their parents or their siblings. So those people, at least if when they are when they cross their age of 35, they should get their general health checkup, which includes your cholesterol levels, your sugars, your thyroid profile, all those things. These are the blood investigations that one should do. Another thing is, it is kind of mandatory to at least do checkup which includes your ECG, stress test, and 2D echo. uh, Initially, if that comes as normal, then at least in next 2 3 years you at least do it for once. So every 2 or 3 years you should do it for once, for those who are having a significant family history of heart disease, and at present they do not have anything. Secondly, those people who are at high risk, those who are smokers, those who are binge drinkers, they should do it almost every year. So many of the corporates and many of other companies as well, I think they have their yearly health checkup where they do ECG, 2D echo, and stress tests for all these patients. Another concerning fact that I come across, that many of the youngsters, they go to the gym, and you may have heard the news of celebrities as well, collapsing in the gym, or somewhere you're close by collapsing in the gym. So that happens because they might be having something like a cardiomyopathy. So cardiomyopathy is not a disease of the blood vessels, but it is the disease of the muscles of the heart. So sometimes it runs in the family as a genetic disorder. And when you go to the gym and when you do unaccustomed exercises, like for example, you have never been to the gym, and suddenly you go one day and you start running on a treadmill for a good 15 20 minutes, you start lifting the weights, and such events can occur in those particular people. So I urge, I request everyone who wants to join the gym for the first time, and if you have crossed your age of 30, then at least once before joining the gym, you should do your ECG, 2D echo, and a stress test. So, what ECG means? ECG is nothing but the electrical activity of the heart that tells us basically that if you have any existing heart disease at present or not. 2D echo is nothing but just like a sonography that we do for your abdomen. So 2D echo is a sonography of the heart where we actually visualize the heart and see how are the valves are working in the heart, how are the pressures in the heart, how is the muscle of the heart. So all these things we see. And on a stress test, that is a treadmill test, we make sure we make you run on a stress test on a treadmill that you do in the gym, but it is not that uh, it is not it's just 7 to 8 minutes that we want you to run on the treadmill, where we see if there are any ECG changes that are occurring while you run on the treadmill. So all this test, at least 80 to 90% of the time, they will tell you that whether you are prone to have a heart disease in next 6 months to 1 year, or whether you are fit to go to the gym, or whether if you have an existing problem, probably if you're not having something like a chest pain at present, and those especially in patients who have diabetes, they may not have chest pain, and these problems will be picked up on this test. So you should visit your cardiologist and get done with those tests. And whenever suppose if you are having symptoms of chest pain, so it is very difficult to identify whether it is a chest pain because of the heart or whether it is just a heartburn because of the gastritis. And this is the commonest problem that everyone has it. So whenever the patient comes to my clinic, even listening to their history, I get to know that whether it is a heart problem or actually a gas problem that we commonly call acidity. So it is always better to at least get done with one ECG. With you need not go to a cardiologist, but at least get done with the ECG whenever you have that trouble. Especially if you have a risk factors of diabetes, hypertension, smoking, obesity.
All right. So I think here we hear you, sir, that you mentioned that early screening plays an important role, and especially people who have high risk, they should get themselves screened at least once in a year. And you also shared the test which needs to be done.
Right.
Now, now, so now these tests would definitely not be done by the doctor, by the patient himself. So should he be, visiting a cardiologist for this if there are some early signs, or should he be going to a nearby physician? What's the patient journey, which you advise, the step by step, what should be done?
Right. So if you are having any emergency in the middle of the night, it's always better to visit a hospital straight away in the emergency. If it happens in the daytime, if you are close to any doctor who has these services of at least doing an ECG, you can always get it done, no matter what specialty the doctor is having. The doctor will always be able to read the ECG. If he's not been able to read the ECG, he will call, a specialist like a MD medicine or a DM or DNB cardiologist to, see the ECG, and he will, guide you further. And if you have a cardiologist close by you, it's always better to go to the cardiologist directly so as to avoid any confusion in that.
Okay, so now this is in the case like an event has happened or someone is having a chest pain. But would you also like to, sir, help our viewers understand that if they are at high risk, then what should be the mitigation efforts they should take? Or like for example, if someone is having a family history and after screening you know that your cholesterol is high or your blood pressure is high, so do you recommend any lifestyle modifications to these people, especially with respect to their dietary habits or with respect to their exercise schedules? Anything you like to suggest?
So the thing is that once you have a problem in one of these states, like ECG, 2D echo, or stress test, so you need to visit a cardiologist. You can't just start doing lifestyle modification by your own at that particular point. You need to visit a cardiologist, get an opinion from him, and then we'll go ahead with whatever it is required. Maybe sometimes an angiography may be required after that, or sometimes the results are maybe sometimes false positive, so that time we tend to give them a lifestyle modification. So what is lifestyle modification is nothing but reducing your weight, eating clean and healthy food, going to the exercises, like doing exercises. So generally what we recommend is 150 minutes of exercise, like a moderate intensity exercise in a week. So that comes to 30 minutes a day, 5 days a week. And just to keep ourselves healthy, I always tell my patients to at least have one fruit in a day, at least walk 45 minutes in a day. A brisk walk would be enough, and you do that 5 days in a week. That's it.
Okay. So 150 minutes in a week. So that's important, right? 30
Right.
minutes.
Right.
Right. And anything, which you recommend on the dietary habits, modifications, any do's and don'ts, like, some
Right.
things to be
Right.
avoided completely or some things which people should focus on more.
Yes. So with the heart disease, there are something called modifiable risk factors, and there is something called non-modifiable risk factors. So non-modifiable is something like your age, you cannot change; your race, you cannot change; your sex, you cannot change. So these are non-modifiable risk factors. So you cannot do anything about it. But modifiable risk factors, your blood pressure, your diabetes, your smoking, your alcoholism, whatever it is, you can keep everything in control. So these are called as modifiable risk factors. So looking at the diet, so there is a commonest question amongst every couple, that how much oil should we be consuming, what kind of oil should we be having. So just to keep it simple, there are two types of fats, that's saturated fats and unsaturated fats. So saturated fats are nothing but the cheese, the butter, all those things we have. Milk is also a saturated fat. And unsaturated fat is olive oil or flax seeds, omega-3 fatty acid, omega-6 fatty acids, which are not even in our diet generally. So these are some things that we should focus on. Another thing is oil consumption. So many of my patients, they ask me, "Okay, how much amount of oil should we be consuming in a month?" So you will be surprised to know if I tell you that you should not be exceeding more than 1 liter of oil for your cooking within for two people in a month. And if I ask my patients, most of them are already on 4 to 5 liters in a month. So that is a very concerning thing. And a few days ago, I asked my wife, like, how much oil we are consuming, because I've been telling everyone that 1 liter is the limit. So I got to know that we have been consuming 0.75 liter in a month. So I think with 0.75 liter in a month, my first time experience is that we eat good food, as in there is no problem for 1 liter a month oil, and for cooking your food. So that's is pretty much manageable.
Okay. So I think diet plays a very, very important role for all
Yes.
our viewers who are listening to us. So as Dr. Anup mentioned, go and check back at your home how much oil you are consuming in your kitchen in a month. If you're a family of 4 or 5, then how much is the consumption, and then accordingly reduce as well. So you in the beginning mentioned that in this age group, stress also plays an important role in precipitating the cardiovascular risk. Now, if you look at the profile of younger population today, if they are working in corporates or otherwise as well, if they are they are entrepreneurs themselves, there is pressure of timelines, there are workplace stress related issues, peer competitions. What do you advise to the to to this group? How do they manage themselves and reduce the risk of the cardiovascular disease?
Right. So this is a very tough question to answer, because giving an advice is always easy, but doing those things are quite difficult. So what I would suggest, that first of all, that if you are having a lot of stress, uh, substance abuse or going for a smoke or drinking is not an option. That will further increase your stress if you are abusing it. Secondly, there is something called uh, practicing gratitude. So if anybody had read about it, so what is practicing gratitude is, whatever you have right now is a good thing. So most of the people are not having it, or you can always look positively on the things that you have it right now, instead of worrying about the things which you are not having, or instead of worrying about your timelines right now. So just focus on the good things that you are doing, just the focus on the right things that you are doing, and try to stop worrying about the things you don't have, or try to stop worrying about what will happen if I don't do all these things. So this is something called as gratitude practicing. So that is one of the most important factor to reduce the stress, but which is very difficult to practice. And the another factor that everybody knows is meditation, yoga. That, and if I tell you something, that even if you practice meditation for at least 20 minutes in a day, which is practically very difficult. For example, if I ask somebody to just lie down for 5 minutes and do not think about anything, just lie down for 5 minutes, even to reach to that level, I guarantee you, if you're not doing it, you will take at least a month. So we don't know, how to shut our brains even for 5 minutes. So these things actually help reduce stress, and stress is not reduced because of smoking when you have stress. So practicing these things are very difficult, but if you one step at a time, if you start it right now, you will be probably after a month or something, you will get to know that how much your stress is reduced after starting practicing gratitude and yoga and meditation.
Yeah, and I think as Dr. Anup earlier mentioned, see, most of us would know these things that meditation is important, yoga is important, and these things will help reduce the stress or anxieties. But he mentioned the most important thing in the beginning, that saying this, knowing this is one thing, and then implementing this is another, doing is another. So if you are hearing us today, or if you hear us later, start practicing it. Let's implement, and let's see if it helps. If it helps, then maybe you can continue as well. But that's a very important piece of advice which Dr. Anup is mentioning. So you talked about some of the habits, and the younger population these days. It's felt that to reduce stress, you go out on weekends, you party hard, you work hard for 5 days, and then you party hard for 2 days. And we see these days is binge watching, binge eating, all these terminologies are coming in,
Right.
and people feel that these things reduce stress. I want to know opinion from you as an expert, that does these things, they reduce stress, or they add to the complicated situation a person may be in?
Right, right. So it's a good question. So basically, everything you do should be in moderation. So if you do something in excess, which causes problem to your family members, it means that you are doing that thing in excess. For example, binge watching. So if you're watching Netflix or any other thing for that matter, OTT. So if you watch, for suppose example, a movie in a week or something, which is, I think, if it is going to relieve your stress, then it's a good thing to do it. But if you keep it doing every single day, so, and if your work is getting hampered because of it, your exercise is getting hampered because of it, and then you give an excuse that I do not have time for exercise, but you spend maximum time on OTT or mobile on or any reels, then it's a problem. So you do whatever thing you need to do to reduce your stress. Some people, they have hobbies like playing guitar, playing an instrument, just painting, roaming, trekking. Even those things also can reduce your stress, but anything in excess is a problem. So that's I want to highlight.
Okay, so I think take advice from Dr. Anup on this, and a very important advice, because I think everyone has to manage the stress. So since you're also running out of time, I'll ask one or two last questions to you. Now, getting a cardiovascular disease early on in the age group also means that you have now more number of years or a large life in front of you. So one of the key thoughts which people get and they feel stressed out is that I have got a heart attack now or a heart disease now. How will I manage rest of my life now? Would it be how will be my quality of life? So I want to understand from you as an expert, that today do we have the right kind of medical help available, or the medications available, which can ensure that a person, even though he gets it early, the cardiac disease, but he can still live a longer and a normal, healthier life.
Yes, definitely. So uh, it's not that once you have a heart attack you are going to die or your life is going to reduce or something, but definitely if you follow your doctor's advice or if you don't take your medicines regularly, once you have a heart attack, it basically has a lot of impact on your mental health, on your financial situation, on your job profile. So a lot of things go wrong after having a heart attack. But you can again come back and stand in whatever the particular position you were before having a heart attack, only if you take good care of your body, if you take whatever the medicines has been prescribed according to your doctors, if you follow up with your doctors really well, and things will fall on place. But it may take a year or so, but things will be fine, and it doesn't mean that your life expectancy has been decreased. But this may happen in people who deny that they have a chest pain, and there is always a denial. Whenever you have chest pain, you feel that there is acidity. So I urge to those people who think that they will never have a heart attack, They should always go and visit a doctor whenever the such symptoms occur. Why I'm telling you this? Because if you are by chance having a heart attack and if you feel this is an acidity and if you don't happen to go to a doctor, then you're losing a lot of time. So when heart attack means basically there is a blockage, 100% blockage in one of the blood vessels of your heart. So those blood vessels supply blood to the muscles of the heart. So when the blood is not being supplied to the muscle stops working. And the more the time you lose, the more the muscle you lose, the more the heart pumping you lose. And then once you lose that heart pumping, if the time is too much, if it is more than 4 hours or sometimes it is more than a day or more than 2 days, then getting back to normal life becomes difficult. So earlier is better. Stitch in time saves nine, that we call. And or there is a saying that time is money. So we say time is muscle. So if you spend a lot of time in finding out whether I have a heart disease, or just thinking about I don't how will I get a heart disease, it's not possible. So then start avoiding these practices. And uh, there is a denial, which is a normal human tendency, but you always visit a doctor. What will happen maximum? Your ECG will be normal. You will be fine. But it should never happen that you have a heart attack and you are sitting at home.
Okay. So I think for all the young people who are watching us today, so as he says, don't be in a sense of denial. Go if you have even the smallest of symptoms, go and talk to your doctor. And then if you are following the advice of your doctor with respect to the lifestyle measures they tell you and the medications they tell you, I think you can still have a long and a healthier life without worrying or stressing you out. And that's a very positive assurance which Dr. Marjani gave to us. Sir, I'll just take in the last question and on this note.
Yeah.
You mentioned something related to exercise and if people join in the gyms. So now people are more aware. They want to be fit. They join the gyms, and then we also see a lot of people taking up marathons, half marathons, full marathons. There's a these days in every city there is these things going on, and this is seen as a marker of fitness as well. So, any advice you have that people who embark on the gymming or stressful exercises or marathon running, the should they take some prior advice from their cardiologist before embarking on all this?
Yes. So whenever you do any exercise, make sure that you start very slowly, step by step, step by step. So if even if you want to run a marathon, so there are a lot of training classes before that. That if you want to run a half marathon, which is 21 kilometers, or you want to go for an ultra marathon, which is 42 kilometers. So you can't just wake up one day and think that I'll finish the marathon. Never do that, because this will cause a lot of trouble to you. Your body will ache. You will tend to have a lot of other problems, and sometimes some unfortunate events has happened in many of the marathons, that people have collapsed and died in the marathon itself. So I would suggest them to go for the training first. At least prepare for your marathons for at least 6 months before you want to participate in any particular marathon. And that's how it should be done.
Okay. So I think that's a very specific piece of advice. Thank you so very much for sharing this with us. So I hope for our viewers this conversation would have been useful today, and Dr. Anoop has shared with us the full spectrum of what should be done and what should not be done by a younger population, young people, to take care of their cardiovascular health. But before I conclude this program, I must thank him for joining us today. And I also must thank all the viewers who have been watching us today or who may watch us later on. If you have anyone in your family or friend circle who is having a family history of cardiovascular disease or some of the risk factors which sir told us earlier, then you must share this link of this conversation with them, and this can be very very useful for them. But before I say goodbye, sir, I give it back to you. Any closing remarks which you would like to send to our viewers, or anything important which we missed, which you still want to emphasize for the day?
Yeah, so I just want to tell everyone that stay happy. The more happy you are, the more healthier you will be. Start practicing gratitude. Start exercising. Start every step in your life. It's maybe a small step, but eventually it will lead you to your goal. So it's very simple. Nothing will happen like a miracle, but you have to take one step forward for your own health.
All right. So on this note, we say goodbye to everyone. If you need more information or want to seek any help, if you live in Mumbai or somewhere nearby in Maharashtra, you can always visit Dr. Anup Mahajani at uh, uh, at Medicover Hospital in Navi Mumbai, or he is also at HeartMate Advanced Cardiac Clinic. But in case you are watching us in any other city, I think go and meet your nearest cardiologist if you have any of the slightest of symptoms which Dr. Nandu mentioned to all of us. So with this, thank you so very much, sir. Thank you very much. You took out your time today
Thanks a lot.
and discussed these things with us. And thanks to all
Great.
our viewers.